takes a strong, strong, it breaks a strong, strong man. And anything less makes me feel like I'm wasting my time. But the pain and frustration, it's not mine. It belongs to the cattle through the valley. When my cattle turned on me, I was knocked back flat. I was knocked out cold for one clack of the train track. Then I rose a colossal head.
Good. Yeah. Good. Yeah. Never in a way, you know.
Never-ending challenges.
Yeah. But it's good. There's so much good momentum right now.
All right. Good morning, everyone. I am delighted to welcome you here to the Rockefeller Institute of Government, both for those of you who are in person and those of us who are joining remotely. I'm Chief Economist at the Institute, and I am happy to have organized today's forum, Policy Solutions at the Local, State, and Federal Level, which is the final event in a larger series of webinars and briefs. We were able to do this in part with the support of NYSID and the New York Alliance for Inclusion and Innovation, and I'd like to personally thank Maureen O'Brien, President and CEO of NYSID, and Michael Searider, President and CEO of the New York Alliance, for the opportunity to work on this research project. In addition to the forum series, we also have a policy brief, which is available out there, Navigating the Benefits Cliff, which walks through eligibility rules, work incentives, and disincentives of the social safety net. So before beginning our actual content, I'd like to walk through some housekeeping. This forum will be streamed live, and a recording will be available later for anyone who is unable to attend for whatever reason. I know that the weather is a little terrible outside. It's going to be streamed both on the YouTube channel as well as the Institute's website, and you'll be able to find the recordings in both of those places as well. In addition, you can find the recordings of our previous webinars, which focused on some more in-depth look at the barriers, whereas today we're going to be talking a little bit more about policy. For those of you who are in person, please silence your cell phones for the duration of the event. Bathrooms are located on the first floor, and our accessible bathroom is located on the third floor by way of the elevator. We'd also like to note the fire exits, just in case of emergency. Today's discussion will start with a keynote address from Kim Hill, followed by each of our panelists taking part in a 10-minute moderated discussion with me, and then a shared Q&A. One of our colleagues will be walking around with a microphone, so please wait for the microphone to ask your questions so that everyone at home can hear you. So in 2019, the last year before COVID disproportionately affected employment of people with disabilities, there were 1.1 million working age adults with disabilities in New York. In that year, only 39% of those adults participated in the workforce, half the rate of their peers. For New Yorkers in the labor market, those with disabilities are nearly 3 times as likely to be unemployed, 17% less likely to work full-time, and more than twice as likely to earn below the poverty rate. For those with full-time employment, New Yorkers with disabilities earned 15% less than their colleagues. People with disabilities face many different barriers, including eligibility rules for social safety net programs, which limit the income and assets that people who use those benefits are permitted to have. A disincentive to work can exist when losing benefits from working more results in fewer total resources. Benefit eligibility and the effect of work on that eligibility can be incredibly complicated. Benefits programs including SSI, SSDI, SNAP, and Section 8 housing choice vouchers, among others, have different income and asset limits. They can have overlapping eligibility and categorical eligibility requirements, as well as complicated application processes that makes navigating one of them alone difficult, let alone all of them at once. As if the benefits rules themselves were not already complicated, people with disabilities and their families confront a substantial amount of missing information and even misinformation on benefits eligibility. A cursory look at the SSI benefit rules, for example, shows that people who earn above $1,470 monthly would not qualify for cash benefits. However, there are a number of income and asset exclusions, including Ticket to Work, the Plan to Achieve Self-Support Program, and impairment-related work expenses that change that income and asset barrier for folks. But if you're unaware of those programs, all you see is that 1470 number, which has actually changed for this year, 2024. Additionally, ABLE accounts, special need trusts, and other specified saving vehicles allow for asset accumulation beyond the asset eligibility limit. Further, access to health care through Medicaid is protected through the Medicaid Buy-in for Working People with Disabilities program, which currently protects Medicaid for people with disabilities earning up to $74,000, and we'll hear a little bit more about that program in a minute. In our first 3 webinars, we brought in experts to do a deep dive into the current relationship between benefits and employment. We talked to independent living specialists, employers, advocates, educators, and the employees themselves, and learned firsthand just how complicated these programs can be to navigate and the disincentives they create. The conversations identified attributes of barriers that could be addressed well by state, local, and federal policy. The administrative burden or cost of paperwork of applications, renewals, and income verification was a regular feature in the discussion, as was the prevalence of misinformation on eligibility rules and lack of knowledge about programs that support transition from benefits to employment. Many of the issues identified can only be addressed at the federal level. The federal government determines the income and asset cutoffs for SSI and SSDI eligibility, but there's a number of programs in state and local policy that play a role as well. New York has expanded Medicaid, invested in the 55B and C programs for state employment for people with disabilities, and funded various information campaigns and programs and resources. Local governments and local agencies also play an important role in navigating and supporting folks with disabilities as they choose to work or choose to work more. Because everyone should not face barriers to employment regardless of their disability status. With that, I would like to welcome our keynote address, New York State's Chief Diversity Officer, Kimberly Hill-Ridley. Though she cannot be here in person, Kim has graciously recorded an address for us yesterday, outlining today's discussion. Kimberly Hill-Ridley was appointed by Governor Kathy Hochul to serve as New York State's first ever Chief Diversity Officer on February 14th, 2022. This was the same day that the New York State's Office for Chief Disability Officer was created in law within the executive chamber, making it one of the first states in the country to establish such an office. Hill-Ridley is charged with advising the governor and executive staff on policy and budgetary issues as they pertain to disability issues, serving as the state's ADA coordinator and chairing New York State's most integrated services coordinating council, which is responsible for the state's Olmstead compliance. So, without further ado.
Hi. Thank you for inviting me to say a few words at the beginning of this very important event today. My name is Kim Hill-Ridley, and I am Governor Hochul's Chief Disability Officer. I apologize for not being able to have my team there in person, as today the governor is presenting the State of the State, but we are there with you in spirit. That said, the issues that will be discussed here will be thoroughly represented by some of my favorite colleagues and dear friends who make up today's panel. You certainly could not be in better hands. As many of you know, Governor Hochul created the Office of the Chief Disability Officer in February of 2022, and one of her top priorities in the creation of this office was to improve employment outcomes for people with disabilities. From day one, my team and I have hit the ground running with this directive, as we are well aware of the many obstacles that people with disabilities face when trying to obtain employment, including, but most definitely not limited to, losing benefits, including the ever-important Medicaid, having to limit income, ensuring that you have all of your services in place that allow you to get out of bed in the housing of your choice, adequate transportation to get you to and from work, the ever-present stigma that exists among hiring managers, the inability to get reasonable accommodations approved, etc., etc., etc. The list just goes on and on. Acknowledging the obstacles is only the beginning of the solution, and we are quite aware that we have not uncovered all of the obstacles yet. This is why our office has spent so much time meeting with so many stakeholders and continue to do so to this day. Hearing from you is what allows us to propose policy recommendations to help solve these problems. That said, we have launched a number of initiatives that will help. We are confident of that. I'd just like to take a few minutes to describe the most important of these initiatives, which I'm sure that Andy, Drew, Courtney, and Shameka will expand upon if need be. The policy change that I think our team is most proud of and that will have a significant impact is the Medicaid buy-in program for working people with disabilities expansion that the governor announced in last year's budget. As of January 1st, 2025, the income limit will be significantly expanded, as will the asset limit. Additionally, it allows people to work past the age of 65 and get married without losing their insurance benefits. This program does include a fair premium on a sliding scale. We are also extremely proud that Governor Hochul signed Executive Order 31 last year in honor of the 80th anniversary. This executive order commits New York State to being a model employer for people with disabilities. Our office is knee-deep in working alongside all executive-controlled state agencies to develop a strategic plan for hiring more people with disabilities, as well as maintaining data on how many people with disabilities they do indeed hire. In 2024, we expect to further expand the Partnership for Inclusive Internships program that currently exists in New York City to be statewide. This initiative will connect people with disabilities who would like to intern at state agencies with those agencies that are enthusiastic about the idea of people with disabilities working for them. The goal is for many of these internships to turn into full or part-time positions. We have been proud to work with our Department of Civil Service to expand the number of 55B positions that are available, and we continue to work with Civil Service on additional ways to encourage the hiring of people with disabilities. We have reinvigorated the Interagency Coordinating Council for Services to Persons who are deaf, deafblind, and hard of hearing, which will take the lead on improving employment outcomes for people with hearing disabilities. We are working with several state agencies that provide employment services to people with disabilities to strengthen employment first provisions in New York State. We have created a public-private employment work group that meets monthly to discuss employment obstacles for people with disabilities and the policy ideas that might solve them. And in the short time that we have been working on these issues, we have attended 2 national conferences, one in Colorado, the other in Washington, D.C., to present on employment issues as they pertain to people with disabilities. I am excited to also share that we were just invited to participate in a National Governors Association Learning Collaborative with 5 other states on these issues. With state agencies, we also have created, launched, and held 2 annual Disability Rights and Employment Awareness Month, or DREAM, symposiums in October at which people with disabilities, stakeholders and advocates, a multitude of state agencies, and others discuss the issues surrounding the employment of people with disabilities. As part of this symposium, the Department of Labor hosts a job fair directed at hiring people with disabilities. We also host workshops, a vendor fair, and other activities aimed at improving employment outcomes for New York's disability community. I could go on, but I know that my esteemed colleagues will cover the other initiatives that I have not yet mentioned. So again, I am so sorry to not be there in person today, but happy State of the State Day. Enjoy this forum and enjoy your day.
I'm sure I speak for everyone when I would like to thank Kim for taking time out of her State of the State week to record this for us. So now I would like to welcome Shameka Andrews. Shameka is the Community Outreach Coordinator for the Self-Advocacy Association of New York State. Andrews also founded Disability Empowerment Consulting, where she provides disability workshops on self-care, self-advocacy, and disability awareness. In 2006, Andrews won the title of Ms. Wheelchair New York, and she has been the program's coordinator since 2013. She wrote her first children's book, Butterfly on Wheels, in 2017. Andrews serves as the New York State Department Developmental Disabilities Planning Council and Developmental Disability Advisory Council for the New York State Office for People with Developmental Disabilities and the New York State Human Rights Disability Committee. Welcome, Shameka, and thank you so much for joining us. Do you want to start by talking a little bit about yourself and the work that you do?
Sure. I've been an advocate. I'm a person with a disability. I was born with spina bifida, which affects the development of my spine, So I use a power chair. I'm a power chair user. I have been an advocate professionally since college, right out of college, where I kind of, jumped into this arena of advocating for others when I had to advocate for myself and participation of people with disabilities in our college graduation, because the place where they were holding the graduations at the time was not accessible to people with disabilities. So they were not able to go across the stage like the other students that were graduating in the class. So that was kind of my first experience of advocating for not only for myself, but for others to make a difference in the change so people can participate in the college graduation like everyone else. So since then, I have had the opportunity to work on various other projects in the Albany area. That's where I'm from. You know, as you know, Kim was talking about, I participate in the MISC on the employment committee, as well as the Homestead Committee, and as various housing issues and ADA issues here in the Albany area.
Wonderful. When we were talking earlier in the year, you brought up that one of the problems that you have found is that the folks who work with people with disabilities, the direct care professionals, often do not have appropriate or up-to-date information on benefits eligibility rules. Can you talk a little bit about that and whether or not you think there are any sort of policies that would help alleviate that? Is it training? Is it information?
Yeah, I definitely think that people that are supporting people in the employment arena really need, you know, accurate information on up-to-date policies, on what the rules are as far as eligibility and income and resources and things like that. Because I know for me personally, when I was starting to work, you know, I was given misinformation, which led me to have to pay an overdraft for several years. Because the person that was assisting me with my employment journey didn't have the correct information. So I ended up having to pay an overdraft because of that. And I'm sure that that happens to many people. Yeah, so Medicaid and all of these different you know, benefits programs, they send out, you know, information to recipients all the time, which is often confusing and, you know, not able for them to understand. So I think, you know, information needs to be, there needs to be a connection with the benefits offices and the people that are supporting people in the employment arena, rather that be through policy or legislation or training.
Now, from your experience in your advocacy, have you found that employers are, how have you found dealing with employers, particularly when it comes to fears over expensive accommodations or, you know, the paperwork of things like income proofs that are needed for SSI?
Yeah, often I think employers are hesitant to hire people with disabilities because they feel that an accommodation is going to cost, you know, thousands of dollars, or, you know, they're afraid of a lawsuit or whatever. But often an accommodation can be very simple thing, like raising a desk or putting a meeting in a different location, or, you know, putting an office in a different location. All accommodations don't necessarily have to cost, you know, thousands of dollars, and most of them don't. what people are looking for and what they need, the support that they need to be successful in a job. So I think that there's a lot of misinformation there as well, with employers not really knowing, the benefits and what's the benefit for them, and what support is needed to help somebody be successful. So I think there needs to be more education there as well, or training or whatever resources for employers, so they know, it doesn't have to be a burden on them to try to make an accommodation for somebody.
I'd also like to ask about the flip side. Do you see that folks with disabilities who are interested in working become discouraged because they sit down and say, okay, well, I can only make this much money, but it's going to cost me this much per month in order to get reliable transportation to work or to hire someone to help? Do you think that people get lost, get discouraged early?
Yeah, I definitely do. I mean, many people, like me, they probably hear horror stories, and it discourages them from wanting to pursue things. Or, like I said, these different programs, they send out lots of scary looking letters and different things that talk about overdrafts or talk about different things like that. And, people don't understand that. They're afraid that, and I think often we don't give people the skills and the tools to be able to navigate things that may be difficult for them. And, I know for me, it's a lot of information, often these different programs, they have different rules about, disability. That's kind of one of the things for me is like, you have all of these different programs. You have to, and most of them, a lot of them, you have to prove that you have a disability. But every organization, every program has a different definition of what that means, which is a huge barrier. And then not only do you have to prove once that you have a disability under their definition, you have to recertify. And everybody has a different timeline as far as recertification. Some people, it's 6 months. Some people, it's a year. And this, has additional strain on somebody with a disability. Like you said, there's so many different things that we have to navigate as far as our disability, transportation, housing, getting support to get to work or to get out of bed. All of these things that we have to navigate, and working within the system shouldn't be as hard as it is.
Now,
and
yeah, I'm so glad you brought up, first of all of those things, and also the overdraft issue and the overpayment issue. We heard constantly that folks with disabilities, and then you can get paid more in SSI than you are quote unquote entitled to, which means you then owe money. So that's what an overpayment or an overdraft is. And we heard a lot more folks talk about the fear of overpayments than we heard folks who knew about things like the deduction for impairment-related work expenses, or the Ticket to Work program, which protects your SSI for a certain amount of time as you begin working. And you talked a lot about how much information you get and how confusing and overwhelming it is. Do you think that if there were a space for a more streamlined piece of information, what do you think is really crucial for folks to know as they're considering working? What would be in like a one-pager?
I think definitely the things that you mentioned, the work incentives, all of these, there are so many different things out there that support people, and they're not given that information. It's, like you said, they're given information about overdrafts and, being cut off and how difficult it's going to be to get to work and to do the things, but we don't share the information about work incentives. There needs to be a connection between benefits counselors and SSI, and as far as sharing information. Because I think that those are really important. It turns out to just be this strenuous, stressful process with trying to get to work, when finding a job that you love should be a great experience. And, it turns people off and they don't want to pursue it at all because there's so many barriers from, the moment the conversation is even brought up, and it shouldn't be that way.
Well, thank you so much, Shameka, for joining us today. I know we had some difficulties with transportation, which just speaks to exactly what you were saying, and thankfully we have a technological solution to make it possible for you to speak to us today. And on that note of technological solutions, I'd like to welcome our next panelist, Courtney Burke. Courtney has held several high-ranking positions in state government, healthcare organizations, and serves on a number of boards. Her positions have included Chief Operating and Innovation Officer at the Healthcare Association of New York State, New York State's Deputy Secretary for Health, Commissioner of the Office for People with Developmental Disabilities, and Director of the Rockefeller Institute's Health Policy Research Center. She is a colleague of mine, so it's always nice to see her in public. Her accomplishments include helping hospitals across the state manage the COVID-19 pandemic and vaccine rollout, obtaining grant funding to promote health equity efforts, securing $1 million federal Medicaid waiver, which is really important to this topic, and obtaining significant federal funding to support people with disabilities to live in the community, and overseeing the development and implementation of strategic plans at several organizations. So I would like to welcome Courtney. Tell us a little bit about yourself and the work you do, specifically some of your recent work on the role of technology in healthcare.
Sure, great. Well, thank you for having me today, and thanks to the conference sponsors. Just in the interest of being completely transparent, in my other job at Sachs Policy Group, I work with the Alliance for Inclusion and Innovation. I have that privilege. And I'm a huge fan of what NYSIT does, and of course my husband works for the New York State Preferred Source Program. So want to make sure I'm completely transparent that this is not just an occupation, but a labor of love in many respects. So, so thanks for the question. And I've had the opportunity to work with people like Shameka in my career, and I think it's really important that anytime we're talking about a policy concept like this one in particular, that we hear the voice of the people who are impacted first and foremost. And the information that she provided and the real life examples and anecdotes are the types of things that really need to inform policy going forward. We can get to what I think should happen at the federal level, the state level, what I think the opportunities are for organizations that are in this room. Most of the people that I know in this room are already expert on a lot of this. I have to say, I started my career in advocating for people with disabilities, probably the first half of it, then spent a lot of time in larger healthcare issues, and coming back to this, this issue and the issues that you're advocating for and trying to shed light upon, I was completely shocked to see how little had changed, particularly at the federal level. Because when I was first in advocacy, the Ticket to Work and Work Incentives Improvement Act was a wonderful vision. It seemed like it was going to change the world. And to see that the levels of substantial gainful activity, that the asset tests under SSI had not even changed.
The asset test has not changed in my lifetime.
Okay, well, I was just saying in my career, but
and I'm not that young.
Yes, I mean, in that respect, it's a little depressing that things have not moved more at the federal level. But I was very encouraged by the things that this governor has done, and you heard what Kim Hill had to say this morning, reestablishing an Office of Chief Disability for the Chief Disability Officer. I used to work at the Advocate's office, which was sort of a similar agency and had a similar goal, but to see that back and see that attention. And of course the Medicaid buy-in was huge last year. So I'd love to see that momentum keep going. But to get to your question, which I think was about technology, and great demonstration of the positive uses of technology here today with being able to have Shameka participate. Some of the work that I've done in healthcare has been around AI and I wrote a blog about it for Rockefeller back in November last year. I've been just amazed at how transformative it's been in the field of healthcare more generally. There's obviously a lot of important considerations about privacy and things like that, but the ability for people to more easily interact with what has been not the most consumer-friendly healthcare system, and its ability to do that for people, as well as enable them to have benefit programs and other support systems that they don't have to go and fill out a 40-page piece of information and paperwork in order to qualify for those benefits. So I think the biggest opportunities with technology, yes, there are opportunities around better supporting people in a work environment where technology can play a role. But the question today is about the benefits cliff and the complexity of eligibility. And that's where I think there could be some significant change in the next couple years if the state is able to garner the resources to develop a program, sort of what they've done with the Medicaid redetermination process, where they automatically, what they call ex parte, are redetermining people's eligibility based on different data sources. If you're willing to share those data sources, I mean, I feel like nothing is private anymore with data, but it can be used for good causes. And this would be an instance where it could help people not only qualify automatically, but be able to know if they qualify for more than just one program. And I think New York has had, to date, more success at retaining people in the Medicaid program during the redetermination process as a result of the use of what I consider AI, the ex parte determinations and looking at various data sources. So that's an administrative burden that's been there for a long time. It's one of the biggest barriers to people accessing the services that they're entitled to. So I think that should be a top priority for the state.
Yeah, and automatic and categorical eligibility are not new concepts. We've seen this a lot at the federal level when it comes to education, that categorical eligibility for free and reduced price lunch, for instance, instead of having each family apply individually, if a certain amount of your students qualify as in poverty, the feds will fund free student lunch for everyone at the school. And that was a change that was intended specifically to reduce administrative burden. And it was possible in part because all of these data systems exist behind the secure walls of FERPA and HIPAA. And in New York, we also have 2D, which protects education records, which would be very helpful for young folks who are new to the workforce and coming out of our school system and out of our BOCES programs for people with disabilities. Courtney, you care a lot about the consumer side of healthcare and of disability services. How would you categorize what New York is doing to sort of support that consumer experience when it comes to accessing services? Are there things that New York is doing particularly well? Are there things that you've seen in other places that might be good additions to New York's toolkit?
Well, the most recent example I gave with the redeterminations has been phenomenal, but that doesn't necessarily help everybody, particularly people who have different complexities with their eligibility determination process. And so, as you all know, when you've used these chatbots or automated things on the phone, sometimes you do actually want to talk to a real person. Mm-hmm. And there are complexities that even technology has not been able to solve yet, although I do think that with the new technology that's out there that's conversational, it is learning very quickly how to overcome some of that. But so I think that having more assisters, navigators, benefit counselors, those types of things are going to be very important still for the near term, for the next couple of years. And I think that it's one of the ways that the state could invest in the short term to ensure that people get access to the benefits that they're entitled to.
Yeah, and given that we have an absolute shortage of benefit counselors in this state and in all states, it's a highly trained position. It requires quite a bit of school. You need to really understand math. It took myself and our RA quite a long time to wade through these programs, and I have a PhD in economics, so if it's difficult for me, it's not a great sign for other folks. But one of the things that came up is, are there ways, because these benefits counselors are so highly trained, because it's such a difficult job, are there ways that we can make them more effective, either with support staff or with supporting technology? So as we train up new folks, can we make the current workers we have more effective?
I think so, and I think technology right now and the types of technology that I was referring to, the conversational, everybody knows ChatGPT, I think at this point, the way I use it in my everyday job is more of a brainstorm, testing out ideas. I don't use it as the be-all, end-all, it's the facts. But I think as a benefits counselor, it is very complex, particularly when you're learning all of it. It could potentially be helpful in training. It could be helpful in thinking through complex problems for people. So I do think that there are still some opportunities there.
I think the training question is a good one, especially with what Shameka brought up about the fact that not everyone who works with people with disabilities is a highly trained benefits counselor. A lot of them are VR specialists or direct care professionals, and they don't always have the same information that a benefits counselor has. And this might be a really good source of up-to-date information for those professionals who are not keeping up with the minute changes in benefits eligibility and rules, to have somewhere to go to get accurate, up-to-date, non-misinformation. That there was this idea floating around, we heard in the first 3 webinars, that you can only work 15 hours a week and keep your SSI. Well, that's not true. It's a specific income limit, not an hours limit. And if you have impairment-related work expenses, that income limit goes up because those are not qualified as part of that income.
Yeah, I was going to say, I see, and I don't mean to interrupt you, but it is really complex. It's like this constant calibration of you change the minimum wage. All right, so now I can't work this many hours per week. Oh, the levels for this just changed again. It's really hard to keep up with that information. And so if technology could make that real time for benefits counselors where they can see that when they're working with somebody, that would definitely improve the process.
Agreed. And I like that you brought up the minimum wage. This is something we've talked about before. So New York's minimum wage did just go up, which is going to mean people are going to hit their income limit faster. New York also has an incredibly high minimum wage. It's over twice the federal minimum wage, which is what this income limit is set against, which means that you can work twice as many hours in Mississippi and still qualify for SSI than you can in New York. And should people have to work full-time? I think that's an open question, but should they be able to if they want to? Absolutely. So thank you so much, Courtney. And now I'd like to welcome Andy Sink. Andy Sink is the director for the New York Employment Services System, Employment Policy at New York State Office of Mental Health, which has been involved in employment and rehabilitation services supporting New Yorkers facing various barriers for over 20 years. NICE is a resource for all things related to employment and disability, a collaborative employment services case management system, and a ticket-to-work administrative employment network in partnership with the New York State Department of Labor. We've heard a lot about Ticket to Work, so you might hear some more. Sink and his team promote principles, practices, and policies to improve employment outcomes for individuals of all abilities in New York through collaborations with state agencies, service providers, and advocacy organizations. Welcome, Andy, and tell us a little bit about yourself, what you do, and what's at the top of your mind policy-wise.
It's not a short list. Thank you so much for inviting me. I love to be part of these conversations. Every one of the topics that have been touched today fit with what we're doing every day. So the list of things that Kim went through, we're working with her on those things. The topic of benefits advisement, which also should and must include financial literacy. We're working on that daily. We trained 180 new certified benefits advisors last year. So I'll get back to the details of that, but that's a big number for those of you who are familiar with that stuff. So I've been involved with employment and disability for over 20 years. I spent the first half of my career delivering employment services and running employment programs for individuals with intellectual and developmental disabilities, individuals with serious mental illness, homeless individuals, justice-involved individuals, TANF recipients with disabilities. So I was very lucky to be able to work in various programs that when I got to the state side, or the dark side, as some of my colleagues still refer to it as, I had a experience working through various challenges and having a relatively well-rounded understanding of the top reasons why employment rates for people with disabilities have been terrible since we've been able to measure them. Regardless of how you measure them, there are various data sets depending on where you look. They're bad, right? And one of the, I would say, top 3 reasons, if not the top, is understanding of what happens when you work while receiving public benefits. And we could spend the next hour talking about, well, what do you mean by public benefits? You know, so we have federal, we have state, we have local. So NICE, before I get too far away from that, as a resource, the New York Employment Services System is primarily a resource for all things related to employment disability. So if it's related, we likely are doing something. We are housed at the Office of Mental Health, but have the luxury of working with all of our state partners, with Kim Hill at the Chief Disability Office, with our partners at Department of Labor, Disability and Workforce. If we're talking about jobs, if we're talking about workforce, people with disabilities are part of the workforce just like everybody else. So it's the same topic. It might have different things that we're focusing on, but same topic. We perform a few key functions, I think, that structure some of the work. One is that we do have a network of around 200 providers around the state. They're all employment service providers. They use our data system. Data's important for everything. That's another topic we could talk about all day long. And they also they receive the trainings that we provide that are available to anyone, driven by the principles of employment first and recovery and rehabilitation. And one of the key things we're trying to do is equip everyone from state agency leads, folks in the governor's office, down to families and people with disabilities, equip them with the language and the tools necessary to engage in the employment conversation in a meaningful way that pushes against the social stigma and common misperceptions about what it means to have a disability and work. You know, to be able to say and believe, yes, working with a disability is a good idea. Full stop. And, you know, of course, we can break that down into various things. One is social determinants of health. That's a big topic that we talk about. We use data to support that it's a really good idea, right? Common misconception, people with serious mental illness go to work, you get worse. It's not true, right? And of course, people need supports. People need to have things in place to help them out when they need the extra support. But the data supports that work is an incredibly important social determinant of health. Working while receiving public benefits. We will never have as many benefits advisors as we would need, no. Right? And so the question becomes, how do we equip families, beneficiaries, consumers, participants, whatever word you want to use, and of course the services system that is helping them with the language and the tools to be able to engage in that conversation to make employment a priority outcome as opposed to a subsidiary. So one of the things that we're doing, and I'll use OMH as an example, is even in our housing programs, we're doing Employment 101 and benefits essentials, so that if somebody within a housing program says, you know, they need to be asked, somebody needs to be asking them the question if they're not bringing it up, like, yeah, I want to go to work. Okay, great. This is how we engage in that conversation. Not, you know what, if you go to work, your rent's going to change. I don't know if you really want to touch that, you know, which is just a terrible message. But one, anybody who's worked in the services system knows that it's very common.
I mean, this seems like there is a shocking part of this disincentive and this fear just seems to come from the framing of the discussion and the things that are more salient and brought up first, whether it's if someone says, hey, I want to go to work, oh, your rent might change, or oh, hey, I want to work more, oh, you got to be wary of those overpayments and you're going to owe money. Those are very different first things to say than, great, let's find the program that is going to be the most effective. There could be some complications. We'll deal with that later.
Yeah, exactly. And those are what drive what we call the essentials, or the benefits 101, or the employment 101, however we package it for the people that we're talking to. And the things they need to be able to say are, yes, employment is a good idea, and also, yes, working while receiving public benefits is a good idea. You must be connected to a benefits advisor and somebody who's going to help you with financial literacy, right? Like that's always part of it. But being able to say that you will have more money in your pocket at the end of the day in almost all scenarios, and most likely be able to retain free insurance. Those two major things, right?
Yes, especially in New York with the Medicaid expansion for working people with disabilities.
Yes.
By 2025, what is that bound? It's going to be.
I have it right here.
It's
around 80,000 for an individual right now. 65, excuse me, around $65,000 earnings cap for individuals on the Medicaid buy-in for working people with disabilities, which is great. Which and compared to many other states is fantastic. The buy-in part is actually free currently. There isn't a buy-in.
The premium is zero.
Yeah, the premium is zero. Thank you. And then in 2025, there's going to the removal of the age limit is great. So it won't be for individuals 65 and younger. It will be around $300,000 for earnings. So that virtually eliminates the earnings cap for most folks who would be eligible, and also an equitable $300,000 in resources. And
that's the sort of countable resources. There are other resources that are non-countable, including certain kinds of retirement accounts, ABLE accounts, housing, etc. What do you think? Why do you think this information is? It's been out there, and yet it still seems that people, particularly consumers and also the employers we talk to, do not seem aware of this. Is it a lack of information? Is it that it's new?
Which part?
I think that you can keep your healthcare pretty much no matter what.
Yeah, that's a great question. I think it's a symptom of our services system and the way that we socially talk about and prioritize people with disabilities as part of the workforce, or don't prioritize, I should say. And I think that becomes, and it's very complicated. We were talking about some of the multi-systems, multi-paths to eligibility, multi-paths to keeping eligibility, and one of the things we talk about is, while it is absolutely true that there are myths, very common myths about working while receiving public benefits, and I use that broadly intentionally, that are absolutely false, right? That they're absolutely false, that are pervasive, not just within the disability community or within the disability services community, but it's also true that the trauma and the history and the stories of people interfacing with the government pertaining to those disabilities are also true. And we need to make time to have that conversation and unpack it. So Shameka was talking about overpayments, and those are a real problem. If income isn't reported, then individuals receive money from the feds or from the state that they wouldn't be eligible for, and the government's going to want that back.
And it's not just the individuals not reporting on time. There is just a lag in Social Security's system, which means that you can do everything right and still receive an overpayment. And if you're not on top of things and not paying attention and don't know it's an overpayment, maybe you invest in that piece of technology you've always needed to improve your life, and then you get a bill.
Yeah, absolutely. And with that, before I run out of too much time, directly related to that, so we one of the things that we created recently was the NICE Work Incentives Network. And basically, we're talking about benefits advisors and folks who can engage in this conversation. And even for partners of ours who have been doing employment services or psychiatric rehabilitation or something related, we have been a place for them to call to say, hey, there's no benefits advisors in my area. And we hear that from all over the state. And usually the answer is they're likely there. You just don't know where they are, right? You're not connected to them. They're in an independent living center, or they're in a VR funded program, an OMH funded program, or they're at the career center, at the one stops, the Department of Labor. And so what the WIN network is attempting to do is just create a locator map and a directory, regardless of where folks are housed. That's publicly available. It's on our website right now. And we also have a nice learning center. We've got videos and one-pagers on all of these topics. And that's where we trained. OMH, in a partnership with Cornell University, was able to train 180 new certified benefits advisors.
Which is a huge number.
That is a huge number. Yes, absolutely.
It's a truly absurdly large number given how many folks we have working in those positions.
But a key for that, before I forget, the key for that is, though, that's where people need to go to get the really technical stuff, and that has to include financial literacy. So knowing where those benefits are currently going, housing programs where your rent is being paid. A lot of folks don't know that their benefits are currently being used to paying rent. They don't know they're paying rent. Right? And so when they hear, oh, you're going to have to use a portion of this check to pay your rent, they're like, what do you mean? I've never paid rent before. So, and that's obviously a poorly operated system. But the other part of that is the services system as a whole, who aren't going to be benefits advisors, need to have those essentials. You can say, yes, it's a good idea. Let's engage in the conversation immediately. And here are our go-to people to talk to about.
I think that makes a lot of sense. And that is what we found in our deep dive in our brief, which you can read, that there are very few, there's like a couple little tiny holes where if you work more, you will have total fewer resources. Generally, with the way that SSI fade out works, with the way that Section 8 housing fade out works, with the way that food stamps fade out works, SNAP, you will always make more total resources if you work more. There's one little SSDI blip, but that does not apply to the vast majority of people, and it is only a very specific time. So thank you so much. I would like to open the floor to questions if anyone has questions. Heather, behind you, has the microphone.
Great information, everybody. A thought on the Cornell training. We've sent a number of people to go to the training as well. And like you said, Doctor, not everyone gets through it, right? It's been challenging. Is there some thought to maybe maybe multiple tier level of success with this? Not everyone has to be a complete expert, right? But we need lots of people that have basic information out there. And whether or not maybe there's a certificate program that's easier to get through or something along those lines, I think might be valuable. I don't know if you have any thoughts on that.
Yeah, there is a one version, both through VCU. So the two major entities that do benefits advisement training that is counted as for, let's say, by Social Security Administration, right? They're accredited, I guess. So that's Virginia Commonwealth University and Cornell. And I think they both have certificate programs, Steve. So they're, but your point is very well taken. Like, where's the different tiers? So a lot of the folks that we work with, we do the essentials up to a point where they would need to know. So let's say an employment specialist or a psych rehab specialist. But that's a really good idea to call that something. You know what I mean? So we have a training series that gets them to that point where they may pass it off to a benefits advisor. It's a great idea to call that something, to maybe give it more value or define what that is.
Right. So it's like we have a couple of people. One made it through, three don't.
Yeah.
The three felt like they failed, right? Because they didn't get that level. They didn't complete the path. Giving up, frustrated, etc. Rather than, you know what, you got all this knowledge now. You'd be really helpful to a lot of people.
Yeah, that's a great point.
You could have so many more people in the system. You get access VR, OPW to kind of embrace some of this and kind of create some of these programs. We have to do lots of mandated training for staff anyway. We can maybe build this into something mandated for everybody.
And I think this is part of a larger conversation that's happening within higher ed at the moment. One of my specialties is the care workforce, and the idea of career pathways, of stackable micro-credentials, of continuing education for direct care providers, be these folks who work in childcare, work in elder care, work with people with disabilities, everything from a home health aide through a nursing aide, through an RN, through a nurse practitioner. The idea that there are stacking pieces of knowledge is something that could apply within the social services, within benefits counseling, within, VR specialties. And I do know that SUNY is developing a number of these, as are many other organizations. And there is likely space for this kind of micro-credential certificate, continuing education. My mother is a psychologist, and she has to take continuing education every single year. And, there's no reason why this could not be one of those pieces for folks who even peripherally work with people with disabilities to have, your 3 credits per year being about the benefits landscape.
Yeah, we have a curriculum set up to do CEUs for this year for the first time that we're sort of operating, we being NICE for that Work Incentives Network, and anybody else who wants to join. And I think that's a really interesting idea because we don't limit them only to certified or those who are attempting to be certified. And we're doing training for both OPWDD folks, OMH folks, Department of Labor, some of the VR folks joined our training as well. So that would be an interesting idea to think about what parts of that curriculum could work up to a micro-credential or various. Yeah.
Oh, we've got another question.
Is this working?
Yeah.
I can't tell. Okay. Hey, good morning. My name is Katie Carroll. I work with the Association on Aging in New York. Thank you so much to our hosts and our panelists. I have a question about access to benefits and specific benefits. So I am a disabled woman, and that's actually not relevant to the beginning of my story. But when I first started working, and I'm sure other people have this experience, but you hold I held a few small jobs when I just started working as a younger person, and there was some mental hand waving, and I didn't file taxes for that small amount of work that I was doing when I first started working. My question is about people who may be engaged in sheltered employment and may not be making very much. And I was just wondering, what is being done and how confident can we be that folks engaged in sheltered employment are getting credit for the purposes of Social Security, retirement, and disability?
Yeah, I'm gonna ask Maureen to answer some of this. We have an expert.
So my name is Maureen O'Brien, and I'm the president and CEO of New York State Industries for the Disabled, NYSID. We really no longer work in sheltered work environments here in New York State. So through OPWDD, there was many changes in that, and the goal was that individuals who were working in that space were working in the community. So our legislation last year that allows us to operate through the Preferred Source Program, of which Chris Burke's organization operates under this legislation as well, we changed the ratio based on that to 50-50 so that all individuals with disabilities who are working at social enterprises or in the community are fully integrated competitive employment. Our average wage last year was $21 an hour for the 6,000 jobs that we created through NYSID's programs. We no longer work with organizations that use sub-minimum wage, and in fact, there's been multiple pieces of legislation in New York State to phase that out. It will be phased out at the federal level. That is moving down the pike at this point in time. So we're not doing anything in a sheltered environment. Anyone who works really now in a social enterprise that might be run by one of the nonprofit disability service providers that we work with, many of those folks move on. That might be their first job as a taxpayer, and then they move on to other jobs from that place. But there's been huge changes to how that works, particularly in the last 5 years here. I hope that answers your question.
Thank you so much, Reed. I also think there is another piece to this question, which is even outside of sheltered environments, young adults do tend to have a bunch of iffy small jobs that they do not, and that is not limited to people with disabilities. That's, all of us. I mean, I worked a number of summers where I was a nanny, and that's an entirely different kind of job. And there is a problem, particularly for folks who kind of get stuck in that position for a number of their working years, not getting credit for SSI if they're not paying into the system. And I think we are getting a little bit better at that, but this gets to that administrative burden that is not just something, faced by folks who use public benefits or have disabilities. We're getting into tax season, so everyone can have a little bit of a panic attack about the administrative burden of filing their taxes, which even at its easiest for those of us with just one W-2 is still incredibly annoying. And I think it's important to stress that fear, that cost of paperwork is not limited to folks with disabilities. It's just somehow made worse. Mm-hmm. And that fear of losing your health insurance is also not limited, which we keep hearing about. I do not have the statistic off the top of my head, but it is in the brief. There is a significant proportion of Americans who have reported in survey data that they stayed in a job they did not want to be in solely for the health care. Right? This isn't a unique problem. It's just a problem that becomes more stressful if that health care is the difference between being able to get up in the morning and not. Did that answer, or do you want to follow up?
I have another question.
Go for it. Go for it.
Oh. Well, yeah, on that point, so I think Kim Hill mentioned so the Medicaid buy-in, and it just seems to me that in some ways we kind of have to torture ourselves to kind of fit around this reality that people need health care. Mm-hmm. And in a lot of cases that employer-sponsored health insurance isn't going to meet the needs of people that need that very expensive durable medical equipment, that constant medical supplies, complex rehab technology, prostheses, things like that. And I'm just wondering, for the panelists, has that led you to any conclusions about what the future of healthcare should look like? And does that even extend to delinking healthcare from employment at all?
I will just add, I'm not going to answer the second part of the question because that's too big for me. Definitely thoughts on it, but I think currently that you hit it on the head why there was a need for the Medicaid buy-in for working people with disabilities to be expanded and enhanced for those exact reasons. That a counterpoint would have been, well, if they're making that much money, they can just get it through their employer. But of course, that employer insurance may not cover what they need for their essentials, and that's absolutely right. So that expansion is so important. One of the things that we have sort of in and this is the global we with Kim Hill and our teams that we're collaborating on these issues, is talking more to employers about the Medicaid buy-in, and so their HR departments and personnel departments have it on their menu of options. So when it comes around to open enrollment period, which we get the emails, they say it's open enrollment, you get to choose your plan, that's on people's radar. But as far as decoupling insurance from employer plans,
I mean, that is a constant topic, and that is one of those times where we run into the federalism issue that we've talked about before. There are some policies that can only be instituted at the federal level, and New York has to sort of exist within the choices that it has within that system. And I think that New York, over the past, since the Affordable Care Act, has done as much as they can to make sure that all New Yorkers have access to health care regardless of their employment status as they can within, the federal rules. And within the federal rules, it's not decoupled. And there is not, I think New York, among other states, Massachusetts comes to mind, have done a good job of trying to not decouple it, but make sure that folks can get the services they need. It is far from perfect. Courtney, I don't know if you want to talk a little bit about, because I know you've done some work on the legacy of the Affordable Care Act.
Yes, I was actually heading in a different direction, but I can
no,
come back to that. It's just that there are, and I alluded to this earlier, a number of things that are set in federal law that are barriers that really need updating, that are significantly outdated. And I think decoupling would be phenomenal to happen more generally, but especially for this population at the federal level. And maybe that's a good place to start, actually, if they're not ready to do it wholesale, starting with this population. But changing the level that people can earn for the SGA is another one. I think the vision of the Ticket to Work and Work Incentives Act was that there wasn't going to be some type of cliff, that you could work as much as you want at whatever salary you wanted. And it's unfortunate that haven't been able to truly realize that vision. But there's a lot of things that I think can happen at the state level, and everything from some of the supplemental payments being increased to the Medicaid buy-in. I would say keeping people auto-enrolled in programs and not requiring the disability determination as often as it's required right now. I would say on the supply side, we have programs, and again, I told you about my conflicts, but we have a preferred source program in New York, and making sure that we're maximizing that program so that there are jobs there for people as well. I would say having more assisters. An integrated eligibility system is a long-time dream of mine. Tried to make that happen when I worked in state government. I know they're still trying, but we have so much more technology now that the reality of that seems maybe it could happen in my lifetime or in my career, whichever one you choose. But there is a technology, and they're actually doing some of it right now in England with a large company that's integrating a lot of their eligibility systems. So I think it is something that can be done at the state level. Helping people with transitions, we could definitely do a much better job of that when individuals are leaving the school system. But your question was about the ACA. And I think maybe a lesson from that was, it was really important in New York State that there was a clear message that what we wanted to do was keep people enrolled in healthcare, and then actually designing a computer system that would best support that, and then putting the resources toward assisters and navigators. So that's a good model that I think could be replicated for the purposes of keeping people who have disabilities employed.
And just to add a little bit before I go to Maureen, there are examples of using integrated government data for automatic eligibility in the US as well. Wisconsin has a really interesting integrated data system that uses their Department of Labor data as well as their social services data. I know a lot of researchers who use that as a gold mine for writing papers, but they also use it for categorical eligibility, for benefits, for targeted letters, and that was really why it was designed. So it is possible within our privacy laws in this country as well, especially because the UK's are much more intense than ours. So there are examples of this being done in the states. There are a few different states with integrated systems. I think Wisconsin's is just the oldest. So Maureen, you had a question?
I was just going to make two comments, and you just touched on it, and one was categorical eligibility and auto eligibility. I think it's super important. I think it has to be a goal. I have a 19-year-old son who, once he turned 18, we got the Medicaid, the re-administration of proving his disability. And it's funny when you do this with a child where you've managed this their whole life. We were at the kitchen table and he said to me, "So there's no cure for what I have. Why do I have to fill this out again, Mom?"
Wishful thinking?
Yeah, and I said, "I know, buddy." And he goes, so what do we do here? I said, you got to fill this out with the HIPAA forms, and we let everybody. But it was really interesting to hear like a fresh voice on it. Like, okay, so can't they just figure out who has diseases for which there's no cure and make us not fill this out anymore? I said, that sounds very realistic and helpful, and I'll share that information with people. The second thing is, the second comment I just want to make, and I think Michael will echo this with me, is when we talk about the direct care workforce and micro-credentials and other things, we put a lot on a direct care workforce to do things, and we have to pay them better.
My research also bears out that we should pay them more.
So that was it.
Thank you. Let me say I found your programs very, very informative. I come at this from many different angles. My name is Tom Abenante. I'm a former New York State Assemblyman. I was also a county legislator. I'm an attorney, and I have a 23-year-old young son with IDD, autism. So I'm coming at this from lots of different angles. I found your programs very, very helpful. I would like to see more, but going in some other directions. A lot of discussion these days is about people who, I would say, at the upper end of the spectrum of disabilities. And I find that OPWDD, for example, doesn't seem to understand there's a huge number of people with IDD in the middle, many of them nonverbal. And, you know, for example, a comment was made about we're not doing sheltered workshops anymore. Well, by eliminating sheltered workshops, we unemployed a huge number of people who will never find a job in the private sector comparable to the jobs that other people are getting. They are now volunteering, they're sitting at home, and they're frustrated. But where I was really going here was the program was very helpful, but what's the next step? Where's the action plan? How do we push the government to change its attitude to the can-do attitude that you're talking about? How do we get an action plan going? I mean, I'm sitting here taking notes from what I see lots of things. I mean, for example, we're talking about the benefit cliffs, et cetera. It's different in different places.
Absolutely.
You can't live in New York City on
Absolutely.
what you can live in Onondaga County, and yet it's the same limits. You referred to Mississippi versus New York. It's the same concept. I mean, the minimum wage that we raised is still too low. But for New York City or Westchester County, but upstate New York, it's fine. So how do we get this whole system, how do we get an action plan, including things like that? And maybe that's where we go next. OPWDD's attitude basically has changed quite a bit over the years. And I am now a very strong critic of it. They do a lot of good things for a lot of people, but they're standing in the way of a lot of things. Like you were talking before about, will somebody, okay, well, do you really want to take that job because it's going to affect all this? Mm-hmm. I don't think they understand it, so they can't guide someone. They have programs, their programs, for example, prohibit anybody getting paid through OPWDD from helping somebody get a job or be a job coach. Now, if you have a person with IDD who's got an aide, whatever the title happens to be, now he can take them out for volunteering. But if the employer says, you're doing a nice job, I want to pay you $10 an hour, minimum wage, whatever, $15 an hour, that job coach has to, the ComHab worker has to step out. And so Access VR only helps people who have the possibility of becoming independent within a very short period of time. So I think there's a whole bunch of stuff that, you've done a great job on what we've discussed so far. I'd like to see you go further. I'd like to see you go to the next step.
Thank you. Thank you so much. And I really do appreciate that. And I think you have highlighted an entirely additional and different source of complication, heterogeneity. Within this, we've talked a lot about the complexity of the overlapping benefits and all of that. There's also the other side of the complexity, which is adding just the payment and geography and the different types of transportation in different places, the expense of housing, that difference that needs to be somehow covered by all of these rules, as well as the differences in people's ability to work based on the disabilities they have, the education they have, but also the differences in the supports that they may need in order to be successful in their employment and in their life more generally. And that all together overlays a whole other level of complexity. And I think it's important to be reminded that that is still a problem. And I know that, Andy, you have more to add.
Comment on
Sure.
that. The categorical certification is very important. But the result has to be what OPWDD calls person-centered, and it's not.
Thank you.
You want to go first?
Well, I have a blanket statement that is really probably not useful for changing any one policy, but it's the general switching of attitudes and vision from a system that has largely been, how do we make sure people don't earn too much money or get too many benefits? And also, I would say a deficit-based evaluation system of what people can do, as opposed to a strengths-based, how do we put work first? How do we see what are the opportunities there for them? And I know that that's such a vague answer to your question, but I do think that that attitude sets a policy direction and everything follows after that.
Yeah, those are good points. And just to build on that, I think that I'd love to have more time to talk about the continuum of supports that somebody might be eligible for, either through OPWDD or OMH or Department of Labor, or to talk through those various scenarios. But the point is, they're very complicated and they're very often case by case, and so we wouldn't have time to talk about them. So those points are very well taken. As far as what we're doing for New York, and I'm feeling Kim Hill kick me in the shins under the table right now to say, Andy, talk about those things that we're doing. So one is a reboot of Employment First. So New York is an Employment First state. One of the things that we did through a collaborative grant, the short version is that it's the U.S. Department of Labor Office of Disability Employment Programs Technical Assistance Grant that all of the state agencies collaborated on, called NEON. There's different NEONs. There's different things that those TARs are being used for. One of them is rewriting a set of principles that our state agencies agree upon that drive the way we support people through, with disabilities through employment to their greatest level of achievement. And the initial statement talks about including those with the most significant barriers. And so to focus not just on those who are, as you said, at the higher end of the spectrum, or maybe even the middle, but we're talking about everybody. And so I think the reboot of Employment First gets at a lot of what you're talking about. So in 2015, there was an executive order establishing New York as an Employment First state. It established the Employment First Commission, which came up with a series of recommendations. And without going through what those are, they include the individuals with the most significant barriers, financial literacy and benefits advisement, continuum of supports to help people work to their greatest levels of self-sufficiency. And there are various work groups going on right now at the state agency level with Kim Hill and her team and various other public and private partners to reboot those recommendations, bring them up to date, and put them into practice. One is State Executive Order 31. It established us as a state as a model employer. So you'll hear the same acronym. I'm sure it's something you're familiar with, right? So, and that means that builds upon an employment first principle that's called cultural modeling, in which your workforce should reflect the diverse makeup of the community in which it resides, right? And so state as a model employer is helping us to be able to do that. Also, the MISC, the Most Integrated Settings Coordinating Council, of which has an employment subcommittee. The points you're bringing up, including a potential for universal individual work plans, that kind of thing. Like we're talking about strengths-based or deficits-based. What's the plan that's driving the actual intervention? And so those various supports. So those are just a few examples to your question about what we're looking at in terms of as a state, as a services system, and actual activities and actions that are being taken.
Thank you. I think that's super helpful. I also would like to, since you brought up the state as a model employer, I was very privileged before this project. I worked with civil service on an evaluation of the 55B and C program. That is the program for state employment for people with disabilities, which is B, and veterans with disabilities, which is C. And we found that it's a pretty well-used program. We found that it was successful in getting people into state employment, and they just expanded the number of slots that were available with that. There's also a comparable program for New York City public employment, which is the 55A program. And these are not new initiatives. These have been around for a very long time, but I think there's been a really important coalescing of a bunch of these disparate initiatives that have existed for a long time and trying to put them together to make something more integrated and effective for, both the folks who might just need an aid might just need a very simplistic work accommodation in order to be able to do so, to the folks who need one-to-one support in order to be their true productive selves. And I think there are some great changes, and we still have a lot to do, which is why we're all here.
Can I jump in?
Shameka, please.
Okay. I just wanted to say that I completely agree with that. There's a lot of things that are happening in pockets that are very successful that I think, expanding on. There's lots of conversations on, job matching and really highlighting people's skills that would be, useful in a job setting, whether they can only work a few hours a day or whether they can work full time. So really looking at, people's skills. What is it that you can do? If you came from a day program or, something like that, what are the skills that you learned in that program that would be useful in, a job setting? And, customizing jobs, there's lots of conversations about that. And, one of the things that are, now coming up that I'm really excited about, is internships and apprenticeships and, helping people start their own businesses and things like that. So, just all of these things are going on in the state. I think we just need to find a way to make them available to a larger number of people. And also, you're talking about, how the things are connected. We talk about, employment in one group, and in transportation in another group, and housing in another group. All of those things need to work together in order for somebody to be successful in the community. So we need to figure that out as well. And once again, bringing back up, Maureen talked about, filling out the paperwork for, with her son. We always laugh when we get these letters that say, your disability will end in, and then it has a date. And it's like, oh, well, my disability is going to disappear on this date, according to this letter, and we just laugh at it because it's ridiculous. So really, there has to be a way to figure out, like you said, okay, I have a permanent disability that is not going anywhere, and most likely it'll get worse throughout my lifetime. And so we really need to figure out how we can lift this burden of people having to be redetermined when they have a permanent disability. It's my 2 cents.
So we'll go with, we have very little time, so we'll go with 1 or 2 last questions if they're quick.
I think this is quick. It's an observation.
Oh, please, microphone. Sorry,
right,
folks
sorry
at
about
home.
that. I think this is quick. I've been in this field a long time and have been kind of confronted with issues galore. Courtney mentioned she came back and basically the same issues are there. We haven't really changed much. We have, as Shameka mentioned early, a lot of, we haven't done a whole lot to really change the number of people that are employed in the state of New York or in the country, quite honestly, right? And the SSI concerns and the fear of losing one's benefits are big. They really are. No matter how you want to slice it, no matter how many benefit advisors want to put out there, people are scared, right? Families get scared. Work in the Bronx a lot, New York City. Bronx is the poorest county in the state. People depend on benefits. Benefits become critical to a family's livelihood, to have food on the table, a place to live, all those different things, right? I've been involved in a number of different initiatives during my career, looking at how to kind of make some changes with SGA, working with the Social Security Administration, federal government, how do you make these changes? How do you make something really, really change, something meaningful enough to actually change the needle and actually help more people want to go to work and feel comfortable about going to work, right? My thought here would be, honestly, use some of this initiative and this energy from this report and don't just stop here, all right? There's some serious policy things that really need to be addressed on a federal level to make some changes, right? You mentioned, you know, the notion, the differential between minimum wage in Mississippi and here, right? And it's gigantic, right? Yet the same threshold is going to be used, right? Why can't there be a sliding scale? Why can't there be some kind of creative way to actually kind of make it a little more favorable in New York State to go to work as well as in Ohio or wherever it might happen to be, right? That I think there's enough advocates across the country, whether it's the National ARC, whether it's Source America, whoever it might be, that would be really willing to stick behind this and kind of work together to try to make some real change, right? It's not going to be easy, but it would actually make a huge difference. If a decade from now, you suddenly things were so much better that, you know what, 20% more people went to work with a disability and felt good about it, then you've really made a real impact, a real positive change on the world. So I would just say keep fighting this, move it through, use what you've done here so far, and take it that next step, right? Bring it there, bring it further, fight, keep the fight going. So thank you for doing this today.
Thank you so much, and I think that's actually a great closing point. Oh, do we have one more question?
Oh, that's terrible. I'm sorry. You know, Steve took too much time, so that kind of cut into my time. But Steve is absolutely right. I'm Chris Burke. I run the Preferred Source Program for New Yorkers who are blind, as the counterpart to NYSID and Maureen's wonderful organization. I used to run the Agency for the Blind right over here in Washington Avenue, NABA. And what happens very often is the direct service folks in an agencies for the blind, it's the social service folks, social workers that end up dealing with trying to help somebody navigate, because that's how they're coming into the system. And so continuous education, training, really early on to the direct support staff to help navigate that, because they come in from everywhere. So I absolutely support that. And then they're not doing the work they're supposed to be doing because they're trying to help somebody find their housing, all these other things that need to be addressed before we can deal with their vision loss of any kind. But one thing, sir, go back to what we can do going forward, and Maureen, forgive me, but the Preferred Source Program is designed to put people to work. I mean, we have a 15% margin because we have to pay for accommodations, fixturing, whatever it might be to put people to work. Minimum wage is going up, $15 an hour. That's fantastic. It's not enough in New York City, but it's fantastic. Then we come forward with an opportunity to provide a commodity or a service to state government and the organizations that regulate our program. I won't mention the Office of General Services, but the organizations will say, you are too expensive, because they'll compare us to the cheapest commodities available, which come in from Asia, and then we're dead. We can't participate in the program. Our average wage is $15.70 an hour, because we do primarily commodities, because individuals who are totally blind, we do a lot of commodities work. Well, guess what? We can't do those commodities work because they're being compared to China. So an action item could be to start looking at that program, which is designed to put more people to work and get it to work for New Yorkers.
Thank you all so much. We are absolutely out of time, but I will at least be sticking around for a few minutes if anyone wants to ask me or any more questions. This is our final seminar for this project. We will be producing another written document after this. Please feel free to check out and share the recording of this. I would like to thank our absolutely wonderful panelists for taking time out of their day to join us. It's been a great conversation for our audience for participating. Everyone at home, if you want more information on this topic, you can look at the brief that we wrote, which is on our website, as well as the recordings of the previous 3 webinars. They get a little more into the nitty-gritty of the details of some of the benefits eligibility. We have conversations with employers as well for an entirely different perspective. Thank you so much for being here, and everyone get to where you're going before the weather hits us. Thank you so much.